Hi, it's Dr. Sahara Roquette here, and today I wanted to talk to you about a test called the Dutch test that I do use with my patients. Some of you may have done this test, in fact. So I'm just going to show you the test. It comes in a kit like this, and basically it's got absolutely nothing to do with the Netherlands. Dutch stands for Dried Urine Test for Complete Hormones. And essentially, over a day, you pee on these strips of card and then let it dry, dried urine test, and then send it back. And when you get the instructions, there's a form to fill out. And here it's all very well instructed, the different times that you do your samples. There's a few things to note. Don't drink alcohol on the day you're doing it or the day before. Limit caffeine, preferably no caffeine. And limit fluid intake to about 1300 mils. So it is a little bit restrictive, but I don't drink enough water anyway, so it's kind of okay for me. And then just 2 days before, no bananas and no avocados, because that affects how you read the organic acids. So why do I do the Dutch test? So as a lot of you know, I do blood testing for hormones, but I do sometimes also do a Dutch test. The reason for that is that the cost is actually the same for the blood hormone profile or for the Dutch. But with the Dutch, you get some additional information. You get your cortisol, which is obviously your stress hormone, which is really important to know in terms of how it affects your other hormones. You also get readings for things like melatonin and dopamine and other neurotransmitters, glutathione, your antioxidant, and a few B vitamins. And then really importantly, it looks at how you're breaking down the hormones. Now, this is so important in terms of your general health and whether hormones are having a benefit or not, because if you're not breaking them down well, it can increase your female cancer risk, which we obviously wouldn't want. So if that's the case, we can add an extra supplementation, look at different lifestyle changes, and then recheck it. So information and knowledge is power. The earlier you know this stuff, the easier it is for you. I'm about to do my Dutch test again. The last time I did it several years ago, I was not metabolizing my hormones well. So I'm doing it to make sure that I have improved that with the supplements and lifestyle changes I've made. And also, as I always say, my cortisol is a little bit high sometimes. So I obviously want to see if that's improved with the changes I've made as well. The Dutch test can also be used for men. So that's good for the men in your life to know, or the men listening to this. And generally, I do think it's a really useful test. So if you haven't done it and you'd like to, do let me know. Or if you think it would benefit someone for them to do it, pass this video on to them and then they can see what they think. I hope that helps. Lovely to speak to you again. See you next week. Bye.